Hi, folks. Yeah, I wanted to do just a quick webinar on back pain, whether that's lower back or upper back pain or neck pain, or into the shoulders as well. It's mainly for people at the minute who are working from home. They would normally work from home. They spend a lot more time, maybe with a different setup than they're used to, maybe with a different seat, different desk. And they're spending a lot of time at the laptop, and they're not up and about as much as they normally would be, given the circumstances at the minute. So I wanted to give chat about some of the considerations for this, and then maybe give you some helpful strategies to help you with your back pain at the minute. So obviously increased desk time is a bit of an issue at the minute. People normally would possibly be up and about and going from office to office or workplace to workplace, and people are kind of stuck at home and spending a lot more time at their desk. So it's important to think about the quantity of time that you do spend at your desk, and whether you are in spending time in a position that is good for you. For every individual, that's different. And as a therapist, I'm really not driven by posture, bad posture, good posture. That's not in my vocabulary. No posture is a bad posture, but like a long duration of time spent in one particular posture is a bad thing. If you spend far too much time with your head forwards and leaning over a desk, if you spend the majority of your time like that, you're going to have back pain. That's probably going to be the case. But also, if you had a perfectly straight spine and you were staying completely upright all day, I would say that's equally a negative thing. So your seated position is important to consider, but the most important thing is comfort in that seated position. And I can actually provide an example, an Instagram post that I did a while ago. I spoke about this topic. So I was trying to demonstrate that a lot of people would adopt the posture on the left here, so they'd stay nice and straight. They would have their shoulder blades pulled back. They'd keep their head stacked on top of their shoulders. And this comes from, from primary school. You're told to sit up straight, and that's what good posture is, and you should always adopt that position. But the guy on the left in this picture is overusing back muscles. He's keeping those muscles tense. For the duration that he's sitting like this, he has to keep his muscles switched on and working. So if you have back pain, you're creating more fatigue, you're creating more use of those muscles, and you're actually likely to exacerbate your back pain. The analogy that I give is if you were to take your fist and squeeze your fist as hard as you can, or not even as hard as you can, even at 50%. If you squeeze your hands together for 15 minutes, your hand's going to start to ache. So the same can be applied to this back position. So if you are squeezing for 3 hours while you're sitting doing some work at a desk, your back is probably going to be sore, or at the very least going to be fatigued in this position. Whereas the guy on the right, he is just slumped a little bit into the chair. The chair is doing its work to support the posture. Shoulders are slightly rounded forward, that's fine. Head slightly forwards, that's fine. It's a relaxed and sustainable posture. But as I said, if you spend hours and hours and hours in one posture, it can become a negative thing. So the key is to get up and move around regularly. So that's one of the strategies that you can employ, is get up and do some exercise. It doesn't even have to be exercise. If you just stand up, reach to the ceiling, reach to the floor, add some rotations in, rotate your torso. just explore the full range of movement that your body has, and just keep doing that regularly through the day, just so that you're not spending too much time in one posture. Another consideration at the minute for people is increased stress and anxiety levels. It just very much depends on your own circumstances. Maybe people have stress and anxiety at baseline. Maybe the whole pandemic is increasing that for people. It's sort of a case by case thing. But with everybody that comes into the clinic, with all of the patients that come in to fix it, we'll always do like a rib cage assessment and check how the rib cage is moving as we breathe. And a consideration is if you undergo if you're under a lot of stress, a lot of anxiety throughout the day, every day, you tend to be in a more fight or flight state. So if you think about your autonomic nervous system, stress is fight or flight. Relaxation is rest and digest. So say like everybody has a pretty busy lifestyle. You might have constant emails coming through, phone calls coming through. You might have something going on in your family. You might have a bereavement. You might just suffer from anxiety. If this is happening, your breathing rate's going to change. So you're going to have an elevated breathing rate. You're probably going to have tighter accessory muscles up in the neck and the top of the shoulders. What these do, they elevate the rib cage. So if you've got a shorter breathing pattern, your rib cage is elevated. So you're focused on drawing air in more than exhaling, because that elevates the rib cage. With a nice, slow, long exhale, your rib cage comes down and into internal rotation. So if you spend a lot of time under stress, suffer from anxiety, if you're asthmatic as well, you can have a bit of dysfunction in terms of your rib cage and your breathing. So your rib cage maybe stays in that elevated state, and you don't really get into rib cage depression. So that sort of limits the movement variability of the rib cage. It limits the interaction of the rib cage and the pelvis. And if your rib cage is elevated, naturally your pelvis will be tilted forward slightly. So your back muscles will be in a shortened position, and your hamstrings will be in a lengthened position as well. So that position can naturally give you back pain because you've got shortened back positions, or shortened back muscles. But also a sort of a sensitive respiratory system like that lacks full movement variability and it will reduce the segmental mobility of your spine as well. So it ultimately reduces your mobility overall. And alteration of breathing and sort of fixing that breathing pattern will help you to get into that rest and digest state. So with fight or flight and that autonomic nervous system response, you're going to have increased pain. Your body's going to be sort of more tense, and you're going to have higher levels of pain. If you can get your body into rest and digest state, then you're going to reduce your pain. You're going to be able to relax more. Your muscles are going to be a lot less tense. So that's another strategy, is bring it back to your breathing. So there are various strategies in breathing. I suggest that everybody downloads the Calm app, because I think it's maybe £3 a month or something like that, for the Calm app. And it's class. It has meditations, it has breathing exercises, it has sleep stories, it has a full library of strategies for stress and anxiety and relationships and coping mechanisms and everything, and it's brilliant. So I recommend downloading that. Alternatively, you can just go onto YouTube and type in relaxation or breathing or meditation, and a very simple one is just box breathing, and so inhaling for 4 seconds, holding your breath for 4 seconds, and exhaling for 4 seconds. You'd be surprised how many people aren't able to exhale for 4 seconds. They're focused on the short, sharp inhale, and they're not getting full depression, full movement of the rib cage. So you can restore that just by performing these breathing exercises, and you can bring your autonomic nervous system into rest and digest, where you're not going to feel pain to the same extent. Your muscles are going to be less tense, and you're going to be relaxed into your chair. So you can do that while you're working, or you can take time every day to do like a 10-minute meditation, or whatever that looks like for you. You have to kind of fit it into what you're actually going to carry out regularly. There's no point in committing to something that doesn't work for you. So see if you can set aside 10 minutes a day to practice this, or if you can just do it while you're working, you can practice some breathing exercises. You'll notice a big change. So another potential area for people is that people that spend a lot of time driving. So your driving position is key as well. And what I would recommend with a lot of people is when you get into your car, go for 3 big, long exhale breaths. So bringing it back to that breathing in the rib cage position again, going for that long, slow exhale. See if you can go 6 seconds out. Sink into your chair. Let the chair support you and relax into that position. You'll find immediately that probably your rearview mirror is probably not positioned correctly for you to be in that position. And that's because you spend a lot of your time maybe too upright or too head forwards. Try and relax into the car and adjust your mirrors accordingly. And again, it's just about being in a comfortable position for the duration of that drive, and especially if you're spending hours in the car and you have a sore back. It's very likely that you need this. So yeah, that's a quick summary and some strategies of what I would suggest for people coming into the clinic. With people coming into the clinic or online physio, I do online physio assessments, and immediately we'll start to look at how muscles lengthen in terms of the deep back muscles, a set of muscles called the iliocostalis, and we'll look at how these lengthen, or if the lower back muscles are overworking. We figure out why that's happening. We maybe need to strengthen the lower limb in some way. Might be strengthen the hips or the legs so that they're doing a better job and not placing too much strain on the lower back. But it's a good idea to get these muscles to lengthen. And one more sort of exercise that I can give you today to think about is a seated back relaxation, and that's going to add lots of length to all of the back muscles from the tailbone right up to the neck. So let me just pull that up on the screen. So with this seated back relaxation, you want to allow the muscles at the base of the neck. So you can see at this position actually, when she drops the head down. That's the first thing to do, is drop the head down. You can see that her head stops once she reaches the end of range of her upper neck mobility. And then when encouraged, she's able to drop the head a little bit further. There you go. So immediately that switches the back muscles off a lot, just to go into that head flex position. And then from there, you're letting the shoulder blades completely fall apart and really reaching with the fingertips towards the floor. This is allowing lengthening to occur at the iliocostalis muscles at the upper spine. And as you exhale, you reach to the floor and curl up the spine completely. You can see how curled up this girl is when she's reaching for the floor, and getting lots of flexion to occur at the back muscles. So from there, she exhales, reaches to the floor, and then spends time in this position at the bottom. And at the bottom there, your rib cage is in that depressed position that I was talking about. So if you have a sensitive respiratory system, if you are stressed and you have that kind of rib cage elevated position, you might find it difficult to breathe down here. But you want to spend some time down here in this rib cage depressed position, breathing slowly through the nose. And what that does, desensitize the respiratory system, brings the rib cage down into that depressed position, relaxes all of the muscles of the back. And especially if you're prone to sitting bolt upright all day and overuse the back muscles into extension, this is a really, really good one for you. And again, you can fit this into wherever it fits into your day. You can kind of do a couple of hours of work and then maybe do this for 1 to 2 minutes. Get up and move around, do your exercises, do your reaches to the floor, reaches to the ceiling, twists. You can go for a walk. You can go up and down the stairs 10 times, whatever your exercise or movement looks like. All movement is great. And then you can, put this into your routine once or twice a day. And it's another good one for bringing you into that rest and digest, relaxation, kind of increased relaxation as well. So it fits in with the breathing exercises. So those are the strategies that I wanted to touch on today. I hope it's been helpful. Give me a call. You can get me on Instagram. That's where most of my content is. So if you want to follow all the content online, come onto Instagram. I do have a Facebook page, Fix It PT on Facebook as well. I'm online at fixitphysio.com, where you'll find information about all the online physio services that are going on at the minute. It hopefully won't be long before I'm back in the clinic as well and doing face-to-face assessments. But the online physio has been great. People are really buying into it. People are really being accountable for the rehab and for their exercises, and I'm seeing really fantastic results with that. So any questions, give me a shout. You can get me on social media or email. Email address is philip@fixitphysio.com. And I'll chat to you all soon. Cheers.